It's day 3 of antibiotics. Well, technically day 4. I started them on Friday afternoon and I have to take them 4 times a day. So this will be my 3rd full day on the antibiotics. I think it's doing something. I'm definitely still a little swollen and it's still painful, but I have to assume they're working. It is just before 10 o'clock on Monday, and I have a few things going on today. I'm just about to go into a skincare appointment just to get dermaplaning done. And then after this, I am heading to the chiropractor. And then this afternoon is my CT scan. So I'm going to be kind of driving all over the place today. Finished my skincare appointment, just had my chiropractic adjustment, which was much needed because despite the fact that the swelling and pain is a lot better, it's still lingering, and like having been in pain for like, I don't know, 12 days now, definitely was carrying more tension in my head and neck. So I'm really glad I got that in. And now I have a couple of hours before I head to my CT scan later this afternoon. Just got back from the CT scan. It was a pretty quick and easy appointment, and they said the radiology report should be getting to my doctor within a day or 2. And I think at that point also I can like log into the online portal system and see the results. So hopefully I will have more information pretty soon. Good morning. It's about 7 o'clock on Wednesday. I'm about to head down to the gym a little earlier than usual this morning because I have my first plasmapheresis treatment in a couple of hours, which I'm very excited about. It is going to take like maybe up to 3 hours for the entire appointment, which is why I have kind of an early appointment this morning, but want to get a workout in first. Already got outside for a few minutes, although it wasn't really morning sunlight because I actually kind of got rained on, but I am hydrated, warmed up, ready to get down to the gym and then get to that appointment. Okay, it's actually the next day. I was planning to do a sauna yesterday and give a recap of my plasmapheresis appointment, but that doctor advised me to wait like 24 hours before doing sauna, just because after that treatment, you're really trying to replenish fluids so that your body can kind of like rebuild the plasma stores. Kind of want to avoid anything that will induce a lot of sweating, so skip the sauna yesterday, but it's actually probably good that I'm doing this update now because I feel like a lot has happened in the last 24 hours. I have several other new pieces of information that are important. So let's start with yesterday's appointment, plasma exchange therapy. You saw kind of the setup and a little bit of how that went. I ended up being there for about 3 hours total. I think the actual like plasma exchange part took maybe 2 hours, and then once that is done, they do give you an IV nutrient infusion because they have found that really like replenishing nutrients afterwards, people get a better result and just recover faster. And you are a little bit like immune compromised as your body is rebuilding those plasma stores in like the 24 hours after the treatment. So they give you like a very high dose nutrient infusion right away afterwards to help that process. And that took like almost another hour because you have to drip it kind of slowly because it's so nutrient dense. Anyway, the good news was everything went really smoothly. They said I did really well in terms of like just the outflow of blood and plasma and everything, or like having good veins that like worked well for this. And that was actually one thing I was a little bit nervous about. Not so much that like they weren't going to be able to find good veins for this, because I generally have veins that are pretty good for this kind of thing, but I do have a little bit of scar tissue on my left arm. The vein in my left arm sometimes can be a little bit tricky, and I know with this kind of thing where they have to actually like pull blood out one side, they do tend to have to use like bigger tubing, bigger catheters or whatever, and sometimes it can just be a little more uncomfortable. So I was just a little bit nervous going into it that like if it was going to be tricky to get everything set up, or that might be like I just was hoping they weren't going to have to poke me a whole bunch of times basically. But what was really nice is they actually just gave me a little lidocaine shot like around each vein before they inserted the catheter, and so I literally didn't even feel it at all, and they got both of them in on the first try. It was super easy. I had zero discomfort. It was great. After I finished the whole treatment and then the infusion, I did feel a little bit, I would just say like kind of icky, which they said was totally normal, mostly because the nutrient infusion they do at the end, it's like a lot of stuff going into you, and you can just feel sort of gross after that as your body is kind of integrating it all. So I kind of just had like a little bit of a headache. Honestly, it felt sort of like you would feel if you were slightly dehydrated, which probably makes sense even though I was staying really well hydrated. I think kind of like the process your body goes through is similar. And so that kind of lasted throughout the rest of the day yesterday. And then I also had a little bit of trouble falling asleep last night. I feel like I didn't sleep as well as usual last night. It was nothing terrible, and you know, that kind of thing could be related to many different factors, but I did have some signs of disruption or like strain according to my Aura ring this morning. My resting heart rate was a little elevated, and my HRV, my heart rate variability, was lower than normal, which again, pretty normal signs that might come up after something like that. That's just sort of like a process your body is not used to going through and maybe a little bit stressful. So I'm definitely not worried about any of that, and I felt pretty fine today, maybe a little fatigued, but nothing out of the ordinary. And I guess at this point I would say I haven't really noticed anything. It's only been maybe 36 hours, and I wouldn't necessarily expect to notice something immediately, or maybe not even at all after this first treatment. But I have the next one scheduled for about 3.5 weeks from now. I think I mentioned before that they do want you to leave at least 3 weeks in between appointments so that your body has a chance to recalibrate or kind of like reallocate any toxins that are stored in your soft tissue to get that stuff basically circulating into your bloodstream again, so that when you go back to the treatment again, you're actually pulling stuff out of your blood, whereas if you went back too early, all of that stuff is still basically being stored in your soft tissue. You're not really going to be pulling it out the way you want to. So I will do at least one more, probably at least 2 more rounds of it over the next 2 months or so, and see if there's any more effects over a longer span of time, and then kind of reevaluate and go from there. They also gave me a supplement to take for the next 10 days and are having me increase increase my vitamin D dose for those 10 days as well, just again to help replenish and help your body recover from the treatment. It sounds like that just does help people feel a lot better and kind of gets a better result in the long term. So have added that in, and I think that's it. I mean, I guess we'll see if anything changes over the next few days or a few weeks, if I notice anything, but otherwise we'll have round 2 the beginning of August. So the other update is cyst related. I got my CT results back, and I did hear today from the ENT that I saw she had reviewed those scans, and actually she reviewed them with an oral surgeon who is like a colleague of hers, and so she called me earlier today to kind of chat about those. I got the CT results a couple of days ago, or maybe like 2 days ago, and so I was able to read the report, which obviously is like a little bit hard for me to fully understand what it means, but my initial reading of it was basically that, yeah, there's like a big cyst on the right side, and it appears to be related to previous surgeries. I can't remember what they called it. It was some kind of specific name for this cyst, but when I looked it up, it sounded like something that can happen after jaw surgery. It usually happens a couple of years afterwards. The treatment is to surgically remove and clean out the cyst, and that particular kind of cyst tends to respond really well to that treatment and usually is no longer a problem. So that all sounded pretty good. Like, okay, maybe it is just a cyst related to that surgery, and if I do the oral surgeon route, hopefully that would kind of be the end of it. So I called the office of that oral surgeon. Could I send them the CT scan, and then like would I need to meet with the doctor again, or how quickly could we proceed with scheduling surgery? And so they said to get those scans sent over, that once the doctor was able to review them, I wouldn't need to meet with him again. He probably would just like update my surgical plan if needed, and then they would get in touch with me about scheduling that. So the imaging place that I went is going to be sending over those scans. They have to like make a disc and actually mail it to them, which is kind of a bummer. Hopefully they were able to get that out today, or like at least get on top of that today, and maybe the oral surgeon will have it first thing next week and won't take too long to get through these next steps. But I also sent them, just like emailed them a copy of the actual report. So they don't have the images yet, but they do have the report that kind of says what the findings were. Sort of hoping that with that, maybe it would at least be enough information for them to know like what kind of appointment I would need to schedule and maybe get me on the schedule. And then in the meantime, they'll get the actual imaging and can like do their surgical planning or whatever. I don't know how much of that they will need for me to be able to actually schedule the appointment, but I sort of was telling them, like, I've been in pain for like 2 weeks now and it's not getting better, and just really don't want to wait any longer than I have to at this point. And I also, like I said, I talked to the ENT who had ordered the CT scan, and she had spoken with another colleague of hers who is an oral surgeon, and she sort of reiterated what the report said, that there's a pretty large cyst on the right side. It's not blocking sinus flow, and I guess it doesn't appear to be like actually related to my sinus. It seems to be more related to the teeth on that side, which probably is why I feel it so much in those teeth, and not like I'm not having like sinus problems. But it also sounded like there was fairly significant bone deterioration because of it, which does not sound great and sort of freaks me out. I guess I don't know what that means for surgery, or like, does this make things more complicated, or do you just have to like remove the cyst and let the bone heal and hopefully regenerate? I don't know. So that's kind of why I wanted to make sure that the surgeon had the CT scan and could review that before we schedule surgery, because potentially maybe that makes it more involved. I guess I will find that out. But the ENT also was asking like if I was doing better having been on the antibiotics now for about a week, and I told her that it wasn't really getting better. Like, it's a little bit better than it was, but I've been on the antibiotics I think for basically 7 days out of 10 now, and it's still swollen, it's still painful. So if there was an infection, you would have thought the antibiotics would have pretty much cleared that up at this point. And she did say, like, given the imaging, she's not sure it's just an infection or like even an infection in there. It might just be more that this cyst has grown and is putting pressure in that area, and that's why I'm swollen and painful. So it's also kind of a bummer that potentially I took these antibiotics without even having an infection. Although maybe it's both. Maybe it's like the cyst has grown and is a little infected. who knows? And I guess we kind of had to assume that there was an infection just given the way it was presenting, especially when I went to see her and it was especially swollen and painful. Anyway, I was really hoping that antibiotics were going to relieve this pressure and pain that I'm feeling, and it kind of hasn't. So now I'm feeling like I'm gonna be stuck in this state until I can get the surgery scheduled, which is not ideal. So it's been a lot of information in the last day or so, kind of a lot to process. I've been making a lot of phone calls to all these places trying to get everything coordinated and just like get everybody the information they need as fast as possible so that I can move forward as fast as possible. But of course now we are sort of at the end of the week, so I'm not sure that really anything else is going to happen before next week at this point, but we'll see. Maybe best case scenario would be like they would let me schedule a surgery, get that on the books so that once they have the CT scan, we're all set to go and don't have to wait any longer. But I will keep you posted. Good morning, happy Friday. It's just before 7 o'clock. Today I have one last medical appointment for the week. I actually have to go back to the same radiology clinic that I was at on Monday for my CT scan, but this time I'm getting a pelvic ultrasound, which is something that I've done many times over the years, but haven't done one in quite a while. And basically just because I haven't had a period in so long, it is sort of recommended that I occasionally get an ultrasound done just to make sure that like nothing looks abnormal, which it never has, thankfully, but always good to just kind of keep on top of that. So I'm going to start off my morning as usual, getting some movement in. Already got outside for a few minutes of morning sunlight, and my Oura ring this morning did say some minor signs of strain. Yesterday it actually said major signs of strain, which was maybe not unexpected because that was the first day after my plasmapheresis treatment, and I kind of expected my body to be recovering from that a little bit. My sleep has still been really good, and so that's helping, but there are some metrics that are still showing up as like indicating that my body is slightly stressed out. It could also be the cyst and the inflammation that's going on there. That's still painful, and I'm also on antibiotics, so there's a lot of things that could be playing into that. I'm not that surprised, and given that for the most part I feel pretty normal, I'm not super worried about it, but just keeping that in mind as I go throughout my day and as I do my workout this morning. And then also really hoping that maybe I will hear back from the oral surgeon's office that I talked to yesterday. I'd sent them over the report from my CT scan and was hoping that might be enough to let them get me on the schedule. They did kind of indicate they would probably want to have the doctor look at my actual scans before scheduling anything in case the new scan would change the treatment plan that they had given me from a couple of months ago when I originally did my consult with them, but we'll see. Maybe, hopefully, I could hear something from them today. I have to make extra sure that I am well hydrated this morning because for the ultrasound, they ask that you come in with a full bladder. I guess that's how they get the imaging. So it's not the most pleasant situation, but it has to be done. Alright, ultrasound is done. That actually went a lot faster than I was expecting, but I'm also not like super concerned about these results, not like with the CT scan where I really was kind of anxious to get them back. This is more like a routine checkup. So not expecting there to be anything surprising in there. But if I ever did want to go see like an endometriosis specialist, in case that seemed like a potential path that might be worth exploring, I would need this updated ultrasound. So figured it wouldn't hurt to just get that done, since it has been a few years since I've done one. And then there is a endometriosis specialist that my doctor was going to refer me to. This would be step one in that process anyway. It is the end of the day. I did not end up hearing anything from the oral surgeon's clinic today, which is probably not surprising. I just was really hoping. So I think if I don't hear back from them by the end of the day on Monday, I will probably call them again and just like beg them to let me schedule something, or at least try to like find out how quickly I'll be able to get in once they have reviewed my new scans and everything. Because I'm almost done with the antibiotics. I'll be done with those over the weekend. And obviously I'm still a little inflamed and still pretty uncomfortable. And if it wasn't actually an infection that was causing the pain and swelling, then clearly the cyst has just probably gotten bigger. I don't know if that would count as like an emergency situation, because I know they do or can get people in super quickly for emergency surgery, but I'm guessing that's more like, you know, injury or something that like has to be dealt with immediately, or else it's not going to be effective or something like that. But I'm sort of hoping if I plead with them a little bit, or like just reiterate how uncomfortable it has been for several weeks now, maybe they can fit me in sooner than later. But I guess at this point, I'm at least gonna have to wait it out through the weekend. Good morning. It is Monday. It's about 7:15. I have a fascial counterstrain physical therapy appointment later this morning. So going to go get a little bit of movement and kind of warm up before that. I feel like with any kind of physical therapy or chiropractic, even like body work in general, I find that I respond better to it if I have gotten some movement beforehand and like kind of gotten all the tissues warmed up. And also with the fascial counterstrain therapy, she always tells me like just don't do any hard workouts for 24 hours, kind of let your body adapt and recover. So I like to get my movement early in the day anyway, but in particular before an appointment like this. And then just really hoping that the oral surgeon's clinic is going to get in touch with me today about scheduling. I'm hoping they will have received my CT scans by now or get them today. So if I don't hear back from them by the end of the day today, I will probably be giving them a call to see what's going on.
For calling oral and facial surgery. For scheduling, press 1.
I had a CT scan sent in. I just wanted to check and see if you had received it yet.
I'm going to put you on hold while I look in your chart here, okay?
Okay, thanks.
We have the report, not the disc yet.
Okay.
As soon as we receive the disc, I can have her look at that and then we can give you a call.
Wondering like kind of what my timeline will be once we are able to get that scheduled.
The soonest in our Minneapolis office would be Monday, August 3rd, about 3 weeks from today.
Okay.
Follow up with her tomorrow, and then it looks like the soonest for us, if we're drifting you off to sleep for this procedure, would be Monday, August 3rd.
Okay.
Wonderful. Okay, I will go ahead and do that.
Thank you very much. August 3rd. No. Okay, it's actually like 2 days later, finally got something actually scheduled. When I had talked to them a couple of days ago, they still needed to get my actual CT scan or like have that reviewed by the surgeon, like update the treatment plan if needed, and then get insurance approval, I guess. They had to do that before I could actually schedule the appointment. So just was a little bit of logistical timing that took a few days. So right now I am scheduled for 2 weeks from tomorrow on the 31st. The only sort of bummer is that that was the first available appointment, but it's at 11 a.m. and you cannot eat or drink anything beforehand. I think usually those would be like first thing in the morning appointments when you have to do anesthesia. So it will be a little bit of a long wait in the morning, kind of like not being able to do anything before that appointment. But I am on a cancellation list in case anything opened up sooner, so maybe just fingers crossed that that might happen. I mean, obviously I would prefer not to wait 2 more weeks at this point, but I guess that's the best we can do. And who knows, maybe I'll get lucky and there will be a cancellation. I can get in earlier. At the very least, I kind of have that off my mind, have something on the calendar, and it does give me a little bit more time to like mentally prepare for that, but I also just really want to get it over with. So on that note, I think I'm going to end this video here. Thank you so much, as always, for watching, and I will see you next week.